Good afternoon to all of you. Thank you for joining this webinar. In the following minutes, we will be summarizing some of the activities that the work package of evaluation within the TransplantChild 23-27 project has been doing in the last months. First of all, let me introduce myself. You may probably have seen me in other TransplantChild meetings. I work in La Paz Hospital in Madrid. My background is it's a specialization in preventive medicine and public health. I also work in the Autonomous of Madrid University. And in the last 2 years, I have the position of co-coordinator of the network, and I am the leader of this work package. As you probably know, because we've been doing some activities on this topic from the beginning of the network, lately when you hear about us in the network, you usually hear from us because every year we are in charge of the monitoring exercise that every ERN does. That was the last webinar we did in January, because as you probably know, every year by February, March, we collect the information that you provide us from all the healthcare providers of the network. And you also put some information on the DigiSante platform, monitoring platform. So every year we have an overall view of the activity of the network and also of the activity around pediatric transplantation that you do in your centers. Also, in the recent years, we've been supporting helping out those healthcare providers that has been going, or they have been doing the 5-year evaluation that is compulsory, that is done from an independent assessment body. And the last healthcare provider that did that was Solgrenska. They did a revaluation in the first semester of this year. And that takes, of course, a lot of time. But if we go further in time, when we started all the networks in 2017, we also did some work around quality and safety standards. The idea was that all the networks had to focus on some requirements that were needed in order to apply for belonging to the different networks. In our case, I will show you some slides we did in that time, and that was about the minimum transplantation activity that every center had to have in order to be a full member of the network. Also, the minimum expertise that the professional had to have in order to also apply for joining the networks, and the requirements, the physical, the infrastructure and equipment requirements that we have to have around the transplantation process. Of course, these standards needs to be updated, and in work package 3, we are planning to go on this work after the summer. What we have been doing in the last month in work package 3 is trying to update all the documents that we had from the beginning of the network. We have been updating the process map of the network. We will show you this work in this webinar. And we have been also working in the last month trying to promote and foster the complaints management process that every ERN has to have. And of course, another issue that is related to quality, we are planning to launch new routine surveys in order to get feedback, not only from all the stakeholders that can have an opinion of what we do in the network, but also about getting information about what healthcare professionals that get to know our activities, what they think about these activities, and also patients. So this is what we are planning to do as inside the project, inside the task 3.3. It's inside the work package 3. And this is the objective of today's webinar. We want to share with all the network these ideas. Some of them are already in progress. Some of them are almost a reality. And well, I hope that we can have some time in the final minutes of the webinar after this talk, so you can give us some feedback. And if you want to do it later on, please don't doubt. Contact with the coordination team here at Madrid La Paz Hospital, and we will gladly get your feedback and try to integrate it into the work we are doing in the work package 3. This is a classical slide that shows us the idea of using standards in the improvement of quality of healthcare. The idea is if we have these standards settled, if they are in relation, they are feasible, they are valid, and they are realistic, we can step by step improving the activities we do. And of course, in TransplantChild, as a network that is focused on recondition, a complex process that is pediatric transplantation, we, as I mentioned, have these standards that are focused on the minimum requirements that are needed to be as a full member in the network. But also, as we already have some information from the different monitoring exercises, we hope, as I mentioned before, to work on these standards from this continuous improvement point of view in the near future. This is some of this work that was done in the network some years ago. As you can see at the beginning, when the first full members applied for the network, we have to establish a minimum number of procedures performed over the two last years. As you can see, we establish this minimum number of procedures regarding the different types of transplantation programs, but also, as you know, it was possible to get as a full member inside TransplantChild, having only one transplantation type of, a transplantation program, type of transplantation program, but also undertaking in the same center the follow-up of other transplantation programs. I mean, you didn't have compulsory to be able to do two kind of transplants, but with one and the follow-up of another one was enough. We also did this work some years ago. The idea is that if we belong to a European reference network, our professionals have to prove a minimum expertise, a minimal experience. And we did this work some years ago, as I mentioned, about this, the different type of healthcare professionals that are involved in pediatric transplantation, but also when we talk about the specialized equipment, infrastructure, and information technology that was necessary in order to do the pediatric transplantation. As you can see, of course, we will work on these standards. It is planned for the future, but what we are going to focus and the work we are going to present is when we believe, and we strongly believe when we talk about continuous improvement, that if we get feedback from our stakeholders, that is also a very important tool in order to improve. So the idea is that now that we have updated the process map of the network, as you can see, our network during the years have developed some core processes. At the beginning, we put the focus a lot on the CPMS, the possibility that the physicians that are attending patients in the different healthcare providers belonging to the network can upload these cases in the CPMS and can have the feedback from the colleagues from other center in order to discuss doubts or condition or get second opinions and provide these patients that are attended in those hospitals with the better option possible. Again, we also have done in the last years big investment in the Peter registry, as you probably know, because we have been doing other webinars about this. Peter is the specific registry for pediatric transplantation, all the different types of pediatric transplantation, and that is also again activity that is done by the physicians, by the clinician attending the patients in the different healthcare providers. But as you probably know, we are promoting other activities in the networks. As for example, we promote audits. We promote not only the adoption, but also the elaboration of clinical patient guidelines, clinical decision supporting tools or care pathways. We do a lot of education and training in our topic. You know that we have not only these webinars or dissemination activities, but also we have recently launched an accredited series of webinars, of activities that again are a way of sharing the knowledge and the expertise of the different healthcare professionals that are working in the healthcare providers that are inside the network. Another topic that we have been promoting is promoting not only research projects among the different members of TransplantChild, but also publications. Also getting into a publication the different audits or initiatives that we have in the other centers, and that can benefit from the potential of gathering so many centers and so many pediatric transplants. And finally, but not less important, is that we also promote inside the network some governance activities. We tend to identify and foster alliances with the different stakeholders. Of course, our funding comes from the DG Santé, from the European Commission, but as you know, the sustainability of the networks is an issue that we have to discuss frequently, and we have to discuss about other funding opportunities that we may have. Again, empowering patients and sharing with the patients that are active, that want to participate in the functioning of these networks, probably with patient associations or other organizations. It's something that we are promoting, and we also mentioned before that if we want to show others what we are doing, the monitoring exercise is also a core process that we promote inside the network. In this case, these governance activities are usually in charge of a representative that every healthcare provider has to have inside every ERN, and those representatives are the people that in each center are in charge of the governance of the whole network. As you can see, this process map that we have updated, that we have tried to make it broader and to show the complexities of the different activities that we are doing, also feeds or gets feedbacks from our stakeholders. That is going to be the next slide. As I have been mentioning, we aim to interact with patients, families, and relatives. Of course, as you saw in the previous slide, we don't interact directly with the patients or the families. We have formal collaboration with patients' organization, and as I mentioned, that is something that we do from our governance activities. Healthcare providers are our main customers, I have been saying before, and we usually talk about healthcare providers from a broader perspective. We don't only talk about medical specialists, but all the healthcare professionals that are involved, who are involved in pediatric transplantation. Something that is also very important to us is the European Commission and the different member states. As you already may know, they are the responsible for the governance of the European Reference Network at European level. We also interact with the coordination of there's a coordination for the 24 ERNs. And as you know, we have contacts with the managers of our different centers because we frequently need their help and their support to promote the network activities in our centers. Of course, as it happens with other processes, we are in contact with industry that is related to transplantation, specifically with donor and organ allocation authorities, and of course, as also it may exist, we also interact with donors. When we want to get feedback with these stakeholders, we can of course interact with them from a reactive way. I mean, getting to know what their satisfaction may be with the activities we do. As you probably know, I mean, the interest of the different stakeholders will be different. I mean, they will have more interest in one type of activities that we do or the other. But when we try to focus on this feedback, we are also trying to collect needs and expectations. So in a way, we don't only know what they think of the activities that we are doing, but we try to, in advance, get information of what else we could do in order to be more productive, more relevant to our stakeholders. As you probably may know, there's different ways of collecting this feedback. As you will see in the last slides of this presentation, probably the most frequent method is the surveys, the polls. As you will see later on, we are developing 3 different surveys to three different groups of stakeholders. We also can take this feedback from the complaints and suggestions that any stakeholder may direct to our network. We will also discuss about that in a slide in this presentation. And of course, we can have this feedback from the different groups that we promote in the network, or a targeted interview that we may have with some stakeholder, because we are interested to get their expectation very clearly. But again, we do a lot of activities, and for example, you can see in the slide the last board of the network meeting that we did presentially in Madrid last year. And these meetings are also a good opportunity. We usually have documents. We have a formal way to get this feedback, and informally to get all this feedback and to get it into our quality strategy. When we talk about complaints and suggestions, I have taken a circuit that we did some years ago, just to remind you that this possibility is open to any stakeholder. I mean, even a healthcare provider representative, they can take their complaint suggestion. We recommend that that it's important that any stakeholder may have the information that they can send their formal complaint, their formal suggestion, or even their expression of gratitude in a formal way. We have a suggestion. I mean, the idea is that we make it more visible in our website, this suggestion web box. Our technical secretariat will register it and take it into account, and whether depending to the issue that is relating, there's two options. If the complaint is in relation, if the problem is in relation to the coordination of the network, we believe that it's a good option that here in Madrid we are not the ones analyzing the complaint, but one of the other members of the steering committee, the different centers that are participating as beneficiaries on the project. Well, we think that one of them should be the ones analyzing this problem, and probably it will be more independent. It will be less contaminated with the opinion that we may have, no? And again, if this problem is in relation to what has happened in a healthcare provider belonging to the network, we will, I mean, the technical secretariat will contact to the healthcare provider representative in order to let them know that this is happening and that they can provide additional information so we can answer the stakeholder from the ERN. As you see, the technical secretariat will gather all this information and will answer the stakeholder. And the work package 3 will have the task of analyzing and reviewing periods, I mean, a year or months, 6 months of this management circuit. So we have an overall view of what kind of problems are getting to us through this circuit. Again, something that is interesting is that some time ago, DG Santé sent all the ERNs that if a stakeholder believes that is not getting a good answer from any ERN, they can ask DG Santé that this is happening, and they could direct their suggestion, their problem, directly to the board of member state. They will be the responsibles to answer the complaints from third parties should an ERN will not address it properly, again, from the point of view of that stakeholder. I think that the idea we are launching with this webinar is that we will finish this because there are some things that are not, closed. We will close this circuit that is an update of a previous one with the work package 3 participants, and we will provide it to all the members, all the stakeholders in our website. So we will particularly show that it is possible to use this circuit for anyone. If we go to the other activities that we have been doing, well, we have 3 proposals of surveys. They are, all of them are in a draft condition, but well, we thought that it would be interesting to let you know what we are preparing for these 3 routine surveys. The first one is should be focused on healthcare professionals. In this case, Padova and Porto are the ones preparing a proposal, a draft. They are preparing a survey that will be specifically addressed to healthcare professionals. Again, what we are interested in to get the feedback of from any professional who from the healthcare providers belonging to the network that have any relation to the network, no matter the role, background, or specialty. And because, as I mentioned, the idea would be to know the level of satisfaction from the different activities, and again from the general functioning of the transplant child. There's no close questionnaire yet, but the idea is that we will let the healthcare professional answering the survey to identify whether they are aware of the different activities that we are promoting, and they can again express their value, their satisfaction with them. As I was mentioning before, in the process map, they could evaluate the networking they are doing through the network, the monitoring activities, the CPMS, the Peter registry, the education training, the CPMS and clinical practice guideline, etc., etc. Again, with we don't have these settled yet, but the idea is that we will get this draft, this survey, and we will validate and pilot the questionnaire with a group of healthcare professionals before launching it as a general tool for all the network. There is no close date for that, but we expect to have this questionnaire done, closed, and validated by the end of this year. The second group would be patients. In this case, Hanover and Necker at Paris are the ones that have prepared a survey containing 30 questions. Those questions include satisfaction with the content, the products that are made from TransplantChild, and the need and expectations that they may have in order to participate, for example, with the elaboration of clinical practice guidelines or clinical support decision tools, or even the opportunity that may be for the patients to network with other patients through the ERN. Again, we expect to close this proposal in the following weeks. In this case, it's going to be more tricky because, as I was mentioning at the beginning, we don't have direct contact with patients. We have direct contact with patients association, but through them, we expect to get their answers, and we will try to do this pilot through them. There's a lot of discuss how we can reach the patients that because if they are not aware of the activities of the network, of course they will not be able to answer this questionnaire. But of course that's the general idea, and as I mentioned, this is the work we are fostering from the work package 3 in the following months. And last but not least, there's a third survey that we are preparing. This one is focused on hospital managers and other stakeholders. There's a proposal done from Bergamo and Stockholm, Karolinska, and in this case they have prepared a proposal that is aimed to hospital managers, ERN representatives and administrative personnel, European institutions and European Parliament health policy officers, and scientific societies and academic partners. In this case, they have prepared a survey containing 11 questions. Some of them value from 1 to 5 the awareness and relevance of ERN activities to each of them, how good or bad we are communicating and promoting these activities, and how they perceive the impact of these activities for them. They propose a Likert scale, but we will probably work with them because we believe that for the overall perception, maybe a Net Promoter Scale and NPS will be a better option. Again, it's not closed, this survey, but we expect to close it in the questionnaire in the following weeks. And we will, again, identify some stakeholders who we believe will help us to validate the questionnaire and to try and to define how we will reach all this variety of stakeholders that may be interested in our network, and they may be interested in providing us their opinion about us. So that is the last slide. As I was mentioning at the beginning, of course, the work we want to promote in this work package will focus. It's a very important pillar, the quality standards and the definition of the different activities that we are promoting in the network, within the network. Of course, this way we will improve our activities. We will improve at the end the process of the pediatric transplantation. But as we have been discussing in this webinar, we want to get into this continuous improvement cycle, the point of view of our stakeholders. Of course, we have tried, as I was mentioning, to focus on 3 different groups. Some of them we have to identify well how we are going to reach them. We will try to validate the method and try to be very specific on how we collect their outputs. But this is the beginning, and we have 2 years remaining of the 2023-2027 grant to put them in place. Again, the idea of this webinar was to update the complaint and suggestion circuit, and we will in the future promote it through the network as another way to let our stakeholders get the feedback to us.